Hi, my name is Aaron Brooks, and today I'd like to talk about low back pain. Typically, people that have experienced low back pain have to go in and get a diagnosis from their physician or a healthcare provider. And most times, the common diagnoses are going to be a bulging disc, a herniated disc, stenosis, spondylolisthesis, or a lumbar strain, or SI joint dysfunction. And those are important. What we do here at Perfect Postures, though, is we look at more of the underlying causes for those particular diagnoses. So one of the top deviations that we find would be a rotated pelvis. So if we were to look at someone that had low back pain and they came in, we would look at to see if the pelvis was actually twisted one direction more than the other. So if we were looking at them from a frontal view, if we put our hands on the top of the pelvic bones here, or just below that, we would see a twist this way, or possibly a twist the other way. Now, if the spine stayed in alignment with that, the whole body would twist, but quite often that's not the case. It's going to be pelvis twisting one way and the torso twisting relatively the other direction. So what we typically find is that because of that, there's going to be a twist in the lumbar spine, and that now sets up an environment for premature breakdown. So if there's a deviation and the person's going through their daily lives or sports or even just simple static postures, there's going to be more stress on one side than the other side, which is quite often why when you look at an MRI, a lot of times it's going to be, the bulge is going to be more off to one side than the other. So that's one of the key factors that we find with low back pain. There's two others that we'll discuss in a little bit, but if that's the case, then you should really kind of think about, instead of just trying to treat that area, we should look at the whole picture and figure out really what the underlying cause is for that.